I'm Eric Humes, and I'm the founder of Keystone IT Consulting.
Electronic medical records are quickly becoming the new standard for all forms of medical practice. The benefits to nurses and doctors, and most importantly, to patient safety, are enormous. Eric Humes created his business, Keystone IT Consulting, to help integrate EMRs into St. Louis medicine.
Keystone IT is an IT consulting firm that specializes in the healthcare industry. IT and technology can directly affect healthcare in how patients receive their care and how quickly test results can be obtained, or physicians can obtain information to then make good clinical decisions.
One of Eric's success stories is the Endoscopy Center of St. Louis in West County.
We saw economies in terms of ability to communicate with other individuals, both physician partners as well as referring physicians, and to have all the information at our fingertip 24 hours, 7 days a week. Everything from the consent form to the nurse's notes to the anesthesia record to the endoscopy report is all electronic, and the only piece of paper that is generated at the end of a procedure is the copy of the report that we give to the patient. When we used to work in the hospital, I think I counted one time 45 pieces of paper that were generated on the basis of having one report. And so we thought that this was a good idea to move on into the future and be completely electronic. Keystone IT has basically designed our network from the ground up and has been able to integrate all of the various vendors that we have for electronic medical records, both at the endoscopy center as well as our practice. The endoscopy reports that are generated from the outpatient center go directly into our electronic health record in our office without any human hands. A lot of people go to different health facilities, different hospital networks, and the information is all scattered. At least when we have information in electronic format, we're able to transmit it to those who need it in a seamless fashion.
Everything is charted in real time, so as a nurse is taking an assessment on a patient, the anesthesia provider or the physician can be in another room looking on a computer and see in real time the answers to those questions in that patient's health assessment.
My mom suffers from lupus erythematosus, and that is a disease that researchers have yet to come to a conclusion as to the cause, and certainly there is no cure as of yet. And so, I look to technology as one of the means by which that disease will someday be cured. And so that's I've seen in many cases where my mother, for example, has gone into a hospital for tests or for a treatment, and they have to ask many questions all over again. It's the same 80 questions that they've asked her, several times. And directly I can see where a quality electronic medical record system, that could capture information and then also allow some secure means to share that information with other providers be very important.
I found their IT support to be very helpful and very supportive, and they get an understanding of what our needs are, and we have somewhat of a sense of urgency when our computers aren't working properly, and they understand that.
We have seen situations where technology has failed and it caused a direct impact in the quality of patient care has suffered from that. Cases where phone companies have cut lines, and which has essentially disconnected a remote satellite office to, say, a headquarters office or a hospital, to where they no longer have the ability to access the critical information that they need to make good clinical decisions.
Our downtimes are very little and very few, but of course when you're all electronic, you need to have the confidence that your computers are going to work every day on time. They have remote access where they can help with any difficulties or problems we have. It's integrated our emails with the offices so that we have integrated email communication with staff and key people in the offices. And it's also integrated the patient records so that we can get information we need on the patient also.
We continually discuss, in fact we have monthly strategic sessions where we make sure that the strategy is appropriate and we adjust where necessary, all the while we're providing their day-to-day support. I believe we're responsible for staying abreast of the changes that the federal government makes, and then also helping to educate our clients and how those changes can affect them. Because St. Louis is a small, big city, a lot of folks know, there's a lot of people that know one another. And so your number one asset is your reputation. And I believe if you make good decisions that are based on sound ethical judgment and you keep your reputation clean, I believe so far business has been very easy for us.
If you would like to find out more about Keystone IT Consulting, visit the website keystone-it.com.